Hi there, I'm Dr. Stephen Fallon. Welcome to Dental Excellence. I believe this might be Dental Excellence 22. We've created a number of these videos over the years, and this video I want to tell you about a specific crown removing instrument that we use. And as you may know, I just completed my full mouth rehabilitation case studies seminar. And during this seminar, I shared some pretty complicated case studies. One of them was a $94,000 case that we presented, or that I completed about 8 years ago. And the complexity of this case had some teeth that had to be extracted, some bone grafting that had to be completed, some dental implants placed, and then we had to phase the completion of the case because of all of this. And because of that, some of the phased completed case, I decided to temporarily cement the zirconia restorations as opposed to permanently cement them, just because we were in the phasing point of this and I wanted to make sure I wouldn't have any issues. So I did temporarily cement part of the rehab. Later permanently cementing it, but initially temporarily cementing it. And sometimes this is the way it goes with some of the more complicated rehabs that have multiple phases. So because of that, we had questions, how do you remove these temporarily cemented permanent restorations? Especially these zirconia restorations, the fit at the margin can be very good. So how do you actually get the crown back off? And I have a nice product for that, so I'd like to share that with you. It's called the Richwil Crown and Bridge Remover, and it's almost like jelly bean. So it's like a really sticky jelly bean. We heat it up in a hot water bath. We get it really soft, and then we have the patient, we put it in the patient's mouth, and the easiest method is to have the patient bite on the jelly bean type of device, the Richwil Crown and Bridge Remover. When they bite on it with the tooth you want to remove the crown from, it sticks to the teeth, the lower tooth and the tooth that you want the crown removed from, if for say it's upper tooth. And when you have the patient open, it pulls the temporarily cemented crown off. Now, if you have an opposing crown temporarily cemented, that doesn't work so well. But assuming that you have an opposing crown that's permanently cemented, or an opposing crown that's just a tooth, even with a filling, this works beautifully. A couple of things you have to do when you have the patient bite on the softened Richwil crown remover. You don't have them open until it hardens, because once it hardens, it really grips on the crown you want to remove. We harden it just by rinsing it with cold water. So we just rinse it with a little cold water and the air water tip, and that seems to harden it within about a minute. So you have to give it a little bit of time, and you could feel by palpating it whether or not it's still soft. So I have a video to show this. So I'm going to share with you this video. It's from this case that I presented during the seminar, during the 2-day seminar. And, I was showing phasing cases. In this case, we completed the upper arch, but we phased the lower arch with bonding. So with the bonding, we did a reshaping of old crowns and bonding to bond in specific contacts and level the lower arch. And then we're able to maybe complete the lower arch in multiple phases. This has been completed for a year and a half now with bonding on the lower arch, and it's been fine. But now I could complete the lower arch by doing porcelain restorations on the lower anteriors, or I could even just redo the porcelain restorations, the old crowns, and some of the larger fillings on the posteriors, or I could do the whole arch at once. Any way I want to do it would be fine. Now, when we were trying in these restorations, we had zirconia crowns on the posterior molars, full contour zirconia. We had implants on the other side, but the zirconia crowns fit so well. I have the preparations fairly strong with resistance and retention form, and they're fairly parallel, so I actually couldn't get one of the crowns off. So I prepped, the teeth fairly parallel, good resistance and retention form. We tried the crown in the arch to check the occlusion and everything, and the one would not come off. So I tried grabbing it with a scaler. The margins are a good fit, so I couldn't get under the margins. I tried kind of just popping it a little bit to get under the margin, could not get it off. So the go-to thing to do in that case is we use the Richwil crown remover. So I videotaped this, and you can watch this particular video right now. Okay, I'm good now. Is it really hot?
Should be.
Okay. And bite down, Mark. And open. Yeah. Bite down on this. You're going to bite into this little... Yeah, and that's probably good enough. Just stay like that. Do not open yet. Maybe bite down a little tiny bit more on this. And this is going to hopefully grab onto that crown and pull it off. But we have to let this set. You'll need to just kind of dry it. So you'll need to suction it and dry it. It doesn't work if it's wet. So just stay biting there, Mark. Okay, now open. Perfect.
There.
That did the trick. It's funny, I could not get that off without... Yeah. Let's not drop that. Okay, that's good. So there you go. Pretty simple technique. Just have the patient bite on it, let it get hardened, and then have the patient open, and they can basically pull the crown off for you and not damage the actual crown. Now, these are originally, we'd bought them from Practicon. We tried to order some more and found that they don't carry them anymore. So we went to Elmore. They're actually built or manufactured from Elmore. So there's the URL to be able to order them direct from Elmore. And the one question you might have with this is, well, what do you do if the patient doesn't have an opposing tooth to bite on, or the opposing tooth is a temporary crown or a temporarily cemented restoration also? So what you have to do is you have to use pliers with the Richwil. So we have the Richwil. I put it on. I don't have the patient bite down, but I push it over the crown, and I try and push it and mold it so there's a ledge on either side of the Richwil, not the crown. So we have it kind of overlapping the crown and creating a little ledge about midway down the facial and palatal surface. And then we harden that. Once that's hardened, that ledge on either side gives me something to grab onto to pull the crown off myself. And I use pliers at that point. So we have the crown and bridge removal pliers from GC. They're GC pliers. And they come with a little silicone tip. You can see here. You can use the emery powder with permanent restorations that we want to permanently cement or that we just don't want to scratch. I probably wouldn't use the emery powder because it's kind of a fine sandpaper. And it helps grip the crown, but it could cause the crown to scratch. So I use this more with provisionals if I want to use these pliers to get provisionals off. But basically, this works really well. So you have a combination of the Richwil creating the ledges, and then the pliers basically grip underneath, and I pull, and the pliers don't slip off because the Richwil's holding on and giving something for the pliers to hold against. And I could pull down or pull up if it's a lower restoration. And this seems to work really well. You can see the disposable silicone inserts. They're sterilizable, but eventually they get worn down. This one looks in this picture like it's pretty much worn down already. Once they get worn down, they don't grip as well. So you just have to take some of the inserts and put them in, and that works well. So those are a couple of strategies to remove temporarily cemented permanent crowns. Or if you have a temporarily cemented temporary that's really retentive and you can't get it off, this is a good strategy for that as well. Some temps get on there and they're pretty retentive. You can't easily remove them. So this is a good product to remove provisionals in general. So hopefully that helps. This is Dental Excellence, and we're striving to give you little tips that you can use in your practice. And I hope you enjoyed this video. If you have any questions, you can leave them under the video and I'll do my best to answer the questions that you have. So thank you very much, and we'll talk to you soon. Take care.